Chemotherapy treatment cancer disease. احمد فلاح نماس 4th class. Introduction. The type of cancer treatment that use drugs to kill cancer cell. Also, we can say it is a drug treatment that use powerful chemicals to kill fast-growing cell in your body. Chemotherapy work by stopping or slowing growth cancer cell which grow and divide quickly. Many different chemotherapy drugs are available. Chemotherapy drugs can be used alone or in combination to treat a wide variety of cancers. Through chemotherapy is an effective way to treat many types of cancer. Chemotherapy treatment also carries a risk of side effects. Some chemotherapy side effects are mild and treatable, while others can cause serious complications. Side effects that occur during chemotherapy treatment. Common side effects of chemotherapy drugs include nausea, vomiting, diarrhea, hair loss, lost appetite, fatigue, fever, mouth sores, pain, constipation, easy bruising, bleeding, and many of these side effects can be prevented or treated. Most side effects subside after treatment ends. How chemotherapy drugs are given. Chemotherapy drugs can be given in different ways, include chemotherapy infusions. Chemotherapy is most often given as an infusion into a vein, intravenously. The drugs can be given by inserting a tube with a needle into a vein in your arm, or into a device in a vein in your chest. 2. Chemotherapy pill. Some chemotherapy drugs can be taken in a pill or capsule form. 3. Chemotherapy shots. Chemotherapy drugs can be injected with needle, just as you would receive a shot. 4. Chemotherapy cream. Creams or gels contain chemotherapy drugs, can be applied to the skin to treat certain type of skin cancer. 5. Chemotherapy drugs used to treat one area of the body. Chemotherapy drugs can be given directly to one area of the body. For instance, chemotherapy drugs can be given directly in the abdomen, intraperitoneal chemotherapy, chest cavity, intrapleural chemotherapy, or central nervous system, intrathecal chemotherapy. Chemotherapy can also be given through the urethra, into the bladder, intravesical chemotherapy. 6. Chemotherapy given directly to the cancer. Chemotherapy can be given directly to the cancer or after surgery, where the cancer once was. As an example, thin disc-shaped wafers contain chemotherapy drugs can be placed near the tumor during surgery. The wafer breaks down over time, releasing chemotherapy drugs. Chemotherapy drugs may also be injected into vein or artery that directly feeds a tumor. Standard chemotherapy regimens include 180 adriamycin and taxotere, 2 ACT, adriamycin and cytoxan with or without taxol or taxotere, 3 CMF, cytoxan, methotrexate, and fluorouracil, 4 CEF, cytoxan, elans, and fluorouracil, 5 FAC, fluorouracil and adriamycin and cytoxan, 6 CIF, cytoxan, and adromycin and fluorouracil. The FAC and CAF regimen use the same medicines, but use different doses and frequencies. 7. TAC, taxotere and adromycin and cytoxan. 8. GET, Gemzar, Elens, and Taxol.